I really think that when you do functional medicine right, you're actually doing conventional medicine right.
Uh,
Using all the tools with the lifestyle, with the root cause. And if you need medication and you need medication, you move the levers as needed. Maybe it is in your head. You never thought you would hear me say that, did you? Well, I didn't say that. But my guest kind of says that. She says that if you're chronically ill, it's important that you also treat your head. Now, don't worry. She didn't say it's only in your head. I would never let that happen to you. But she did say it's also in your head. And I want you to hear her out because she had a lot of great things to say, although we did disagree on some things. And I'm glad that we did that on air because I love that dialogue and I appreciate how we did that with respect. And you can hear different views on some important topics and then make up your own mind with what resonates with you. So this week I had Dr. Mary Pardee. She's a naturopathic medical doctor specializing in preventative medicine and longevity in Los Angeles, California. And she is the founder of Modern Med, a medical practice that provides medical and health services to patients. And one of her biggest pet peeves, influencers on social media. Let's see how this turns out. Enjoy. Thank you so much for being here, Dr. Pardee or Mary. I'm really excited to have you on Medical Disruptor. So usually our guests are people who are in some sort of conventional, hate that term, conventional medicine. And then something happens to really like kind of mess up their life. And then they have this aha moment. But you, I think, are a little bit ahead of all of us because you just went straight into naturopathic. So tell us like how that evolved.
I've actually thought about this a bunch, and I feel like we all have our journeys for a reason, and we get there and we learn things along the way. But yeah, so for me, I had GI issues my whole life. I had constipation and bloating, and I went to see a gastroenterologist. A few of them had colonoscopy, endoscopy, was on a bunch of medications, diagnosed with SIBO, and just like wasn't feeling
Mm.
well, and nothing kind of in my head, like nothing. Acupuncturist, chiropractor, saw a naturopathic doctor. And at a certain point, I was like, wow, this naturopathic doctor is explaining things to me. She's taking time with me. Like the bedside manner was amazing. And so I really wanted to like figure out my GI stuff. So I'm like, that's how I'm going to go into medicine is through naturopathic medicine. And I went and did the whole program and I still wasn't feeling well. And I was like, what the heck? Like naturopathic medicine is fine for me. And so there was, like, some disheartening pieces of that. I remember I saw a gastroenterologist when I was in my 20s, and he, like, looks through my chart. He's like, "You've tried everything. There's nothing else. Just live with it." And I, like, burst
Oh,
into tears, and
I
was
actually want to throw up.
it was one of those moments where it was hopelessness, and I remember thinking to myself after, like, I stopped crying, "I never want somebody to leave my office feeling that way." And
Wow.
looking back, I know it was probably well-intentioned, and I think the same message could have been not the same message, but I think a effective message could have been delivered to me that would have been really helpful. However, it was delivered in a way where it was just, honestly, slightly mean, and it was this whole kind of journey for me that it made me the clinician that I am today, and at this point, I look back and say, "Wow, there's actually a lot of great stuff in conventional medicine, and I think I threw the baby out with the
Ah,
bathwater because
yes.
I hadn't addressed, like, this one piece, and for me, I hadn't addressed the mental health piece that comes with chronic GI issues, and that was really impeding my ability to kind of heal and seal better from a physical standpoint. And so at this point in my career, I really believe I could have gone down the ND route, the DO route, or the ND route and kind of entered into this place of true, what I call integrative medicine, where I prescribe medications to my patients. I also talk about, the mind body connection, the gut brain axis. And that's really what I've kind of accumulated is just that true integrative medicine, in my mind, can use all of the things, not just the natural things.
Absolutely.
Yeah.
Absolutely. Wait, I want to delve more into what your particular degree is because I think you're the first guest for us with this degree. So I want people to understand because we want to educate people the different options they have. But first,
Yeah.
I want to unpack so much of what you said because so you came at it from the perspective of the patient who experienced it. And for me, my wife was the patient and we couldn't do it. But I like what you said that he probably did, even though he delivered it in a way that was probably was well intentioned, because I call myself a recovering medical gaslighter because I had no idea that there was more. And so when all the tests were done and everything is perfect as you experience with your GI, there was nothing left in that space other than to blame the patients. Live with it. You're exaggerating. It's in your head. Like, come on now, like, get through it. And it's not from malice. This is one of my messages. Like, it's not from malice. It's really from a lack of knowledge. Like, this is it. I did everything I know how to do. So instead of saying, oh, well, maybe there's someone else who might know more, you'd be like, that's it. It has to be you. So, and it's great. I mean, it's terrible to experience that, but it obviously made you into a healer to help others and spread the message. So tell us a little bit about what a naturopathic medical doctor is. What is the schooling? What is different than a non-naturopathic medical doctor?
Totally, totally. I want to go one more sentence about what we just said though, before, and then
Yeah, yeah, let's do it.
for me too, it's like a lot of the work I do with people now that have chronic GI issues is around this gut brain connection. And I really believe what he said in terms of like, there's nothing else for you to do. I actually think that there was some knowledge in that for me. Cause for me at that point, if I look back, I didn't need another test. I didn't need
Mhm.
a supplement or another medication. But what you just brought out, I think was very true, where it wasn't in his knowledge base what I did need. And I don't fault him for that because he knows a lot. And how can one
Right.
person know everything? But for me, like that missing link was the acceptance of the condition I had and working on how my thoughts and beliefs were actually affecting my physical GI issue. And this is a piece where I see now, like most GIs don't even know about it, but like there's something called cognitive behavioral therapy and ACT for GI conditions or disorders of the gut brain interaction. And a lot of it has to do with stopping the search. Like, don't look for the next thing, don't do the next test. If we have the information that we need, there's a lot of healing that can be done in just examining the thoughts and beliefs around the actual symptom and how they're changing our behaviors to perpetuate our symptoms versus to stop them, reverse them, and heal them.
Wait, hold on. This is like really revolutionary information. So we'll go back to your degree in a moment.
Yeah.
So what you're saying that in your particular case, you're saying, I guess I don't know enough about your particular condition, but you're saying that there inherently you had to stop searching for a physical cause of your GI
Yeah.
issue?
Yeah, and this is the case where I'm not like this kind of special person either. I see people now that are dealing with this all the time, and it's not until the fact that I've been able to identify it that you can actually start to see it. But there's a condition called disorders of the gut brain interaction now. So we used to have them under the umbrella term of functional GI disorder.
Yes. Mm-hmm.
Conventional medicine. This is
Mm-hmm.
like these are well known, established and established diagnoses. But these disorders of the gut brain interaction got relabeled because of how influential the gut and the brain conversation is to the outcomes of treatment. And so if there's an article by Hauser et al., a research article that starts to explain how this stress cycle can happen, especially in disorders of the gut brain interaction. I'll kind of go through an example. I'll just use myself as the example. But, say for me, it was constipation and bloating.
Mm-hmm.
There's something that triggers it in the beginning. Maybe there was something really stressful, you get a divorce, or maybe it was something less obvious, like you went on vacation, maybe you didn't poop for a week kind of
Mm-hmm.
thing.
Mm-hmm.
Come back and you're bloated and it's not really going away. So there's an initial trigger that exists. And then you get the actual symptom. So let's just take bloating. You start to feel restricted and bloated. And then what happens is really interesting is that the actual symptom of bloating draws our attention to our stomach. And you say, wow, I don't feel good anymore. That increased attention to the sensation in our brain heightens emotional centers and pain centers in the brain, and it exacerbates the actual symptoms. So bloating and distension and discomfort get worse. And then that bloating and distension, gets even worse and it creates feelings of anxiety, frustration, whatever it is inside of us. Some people get angry, some people get irritable, some people get worried, like, is it cancer?
Sure, sure.
Emotional reaction in a
So you're stuck in a loop in essence.
exactly. The emotional reaction heightens the sensations. We then get something called visceral hypersensitivity, which can be actual increase in the firing of the nerves of the brain that tell us that we're uncomfortable. And then we develop these behaviors. So for me, it was like I would look at my stomach in the mirror to be like, okay, is it bigger? Is it smaller today? I'd feel my pants, like, are they getting tighter? Or can I even wear these pants? I'd look at my stool in the actual toilet to say, is it formed? Is it loose? What does it look like? And we develop all of these coping behaviors
Yeah, yeah.
heal the symptom. So I'd go to gastroenterologist. I'd do all these tests. I Google a ton. Googling is a big one. And to try to find the answer. And we think we're doing it to reduce our symptoms. But what ends up happening is it sends the message to the brain, something is really wrong here. And it heightens everything. And then it becomes this feed forward cycle. And it gets worse and worse and worse. And so when I say, that gastro wasn't all wrong, is that what I really needed to do there is to start to examine those thoughts, behaviors, and beliefs and to start to cut them off. And inevitably, that was a huge part of what truly healed me.
What you say is really important, but I just want to ask a question after this. So a lot of times for my patients who are chronically unwell, especially like my mold patients, my patients who it's taken us a long time to figure out what's going on, a long time to undo. It's very much understood in the chronically unwell world. The providers understand that in order to get these patients better, we must break that feedback loop that you're talking about. And so in addition to doing the mold binders and whatever else is going on, we're also sending them to like Gupta or any other kind of meditation or anything to help stop that loop, that chronic illness loop. So without question, I'm so glad you bring this up. This is something that I have to kind of get my patients to eventually, right? Because they want very much to see kind of the objective data. And oftentimes there is an objective data that maybe has not been found in conventional medicine. But we can only, if they've been sick for a really long time, can only get so far if we don't address this piece as well. Because they're stuck in unwellness. So I'm
Yeah.
loving this. Like,
Patients are really lucky too, because I think in the functional integrative space, this is a piece that people miss most often. Most of them are not missing testing because they're doing
a million tests.
They're
Yeah.
not missing that. They're not missing supplements, and they're doing a million supplements too. But when this piece is missed, it creates somebody who is stuck in the system forever. And now all we have is green allopathy. We're just replacing supplements
Yes.
instead of medications or whatever it is.
Yeah.
Like this is really like the true healing piece. And to your point, it doesn't mean that there's not a physical component. So like for me, I still needed to fix my constipation.
Okay.
That's much easier when you don't have somebody who's constantly thinking about it, changing behaviors,
Yeah.
things, and going down this rabbit hole. And for some people, it's impossible to heal without healing this piece.
I love that you brought that back. Like you still have to heal the constipation. So because I don't want anyone to listen to this podcast and be like, oh, she's basically saying it's in my head. No, there is something there, but there is also this other piece. And you know what I find also? I find that a lot with wearables, like the wearable devices, like especially my patients have sleep issues. So they'll say to me, I wake up every day at 3. And I'm like, how do you know? I'm like, well, I check my clock. I'm like, what have we done there? We reinforce waking up at 3. You absolutely reinforce this insomnia. Your body's like, oh, we need to wake up at 3 o'clock. And so, oh, I only did this much. If I have people who are really struggling with this and we've eliminated, right, apnea and all these things we need to eliminate, I really encourage them to take these wearables off because it really creates a reinforcement.
Yeah.
This is,
Sleep panic attacks, they kind of have like a common thread in them too, where, like you said, they can reinforce the behavior that you actually were trying to treat against, right?
yeah,
I always think of the movie Forgetting Sarah Marshall. I don't know if you remember, there was like this scene where he's trying to learn how to surf, and the guy's like teaching him how to pop up on the surfboard, and he keeps being like, do less, do less, do less. And I tell that to my patients because sometimes the treatment is like, stop the wearable, like, do less, like,
do
don't
less.
think, like, just try to live a normal life. And you said it perfectly. It doesn't mean it's all in your head, but let's also realize that what goes on in your head 100% affects your physical health. And why wouldn't we want to take advantage of that versus go against it?
It's a piece. Now, I imagine that this particular focus of yours is not, naturopathic medical doctor. This particular focus for you came about out of your personal journey. Like this is not like, right, like naturopathic medical doctor, I imagine, please correct me, is really about the root cause analysis, as many of us are. But this particular piece that you're focused on must be from your personal journey, not your learning. Is that accurate?
Yeah, I mean, one thing that I'm sure about at this point is like I'm a forever learner. I'm obsessed with like learning and figuring out like the best ways to treat things. I just love it. Like it's part of how my brain works. But yeah, in naturopathic medical school, you do learn cognitive behavioral therapy to a
Mm.
very degree, but not to the point where what I'm using today in practice. So this has all come from additional research and working with a million other specialists and practitioners and talking to psychologists. Really, psychology is a field that like they know so much about things, but we don't know a lot about what they know. There's not enough crosstalk between psychologists and primary care, in my mind.
Oh yeah, there's definitely not no. And so it's interesting because you bring a unique perspective to our podcast. And because and one of my questions I ask you, what makes you a medical disruptor? Usually people will tell me where they're disrupting conventional medicine. But your answer is I like dispelling health myths in the integrative medicine space. So say more.
Yeah, I mean, I believe that people come to functional medicine, integrative medicine, most of the time out of their own healing journey. So I find that to be a really common factor, whether it was someone that they love or, them themselves. And I think that there's a lot of beauty in that because I think people come for real reasons. Like they're not, I think most people are here not to make money. They're here to really help people. Doing both is good. But what I've found, kind of coming from the opposite side of many of your guests, is that there's a lot of things in the naturopathic functional medicine world that are amazing. And that's things like treating the whole person, really looking for like the root cause, spending time with people, establishing relationships with your patient. Like we're really good at these things.
Mhm.
However, I've also realized there's a lot of treating from a place that has no evidence to back it, or even evidence that suggests that this is not the best way to treat. And I remember when I was in my early 20s, the reason I went into naturopathic medical school is I had this almost disdain for the conventional model where like they don't know anything. They can't
Mm.
like they actually have a lot of it wrong. And like I was on the, kind of belief of these crazy thoughts that I could talk about all the time now. Um and and then you do the actual research yourself and you start to become really skeptical. And where I'm at today is like, wow, that was a really naive 20-year-old that said those things because I believe that conventional medicine knows a ton now. And we just need to pull the best of all of these things together. And we still need to spend time with patients and we still need to treat the whole person and we still need to look for the root cause. But a lot of the times when I say, root cause, sometimes it's what I just said. It's that mind body connection.
Right.
It's not
It's
a parasite, an
not gluten.
obscure thing that we're like searching down these rabbit holes for. It's something that maybe we have like a little bit of aversion to ourselves, which I definitely did in my 20s. I was like,
No, this is so on point. And I'm so glad we're discussing this. This is why I love the season of this podcast. I'm meeting the coolest humans. You just said so many important things. First, let's talk about that kind of like either or, right? Conventional versus autonomy. First of all, the nomenclature is already a problem. And we know the history of the nomenclature, right? But I really truly believe I don't practice alternative medicine. I don't even know what alternative medicine is. I think it's layers. And you know that almost every algorithm in Up to Date or Hippocrates, the very first line is lifestyle modification. It's just that conventional medicine skips that part, but it's in there. But it's in there, right?
still in the algorithm.
It's still in the
Like,
algorithm.
the AJA guidelines for IBS, it's top of that.
Top, it's all hypertension and diabetes, right? So the first line always lifestyle modification. It's just we tend to skip it. And in conventional medicine, I would say is amazing from ICD-10 code on.
Mhm.
From once we have the diagnosis on, it's amazing. I do not want to be without cancer treatment. I do not want to be without pneumonia treatment. I do not want to be without surgeries. I do not want to be without any of that. So it's not either or. Where I think is the problem, and it's interesting, was the hubris that your GI had, but then it was the hubris that you're describing, the 20-year-old, where this has to be the only thing. So the GI thought it was the only thing, and the 20-year-old said, well, that has to be absolutely not the thing. It's all of it. It's really about understanding that there's a tool for you. You're not going to have a toolbox with just a screwdriver. You have a screwdriver and a hammer and a wrench. And so sometimes you need this and sometimes you need this, and then we layer it. I love that. This is such an important thing. I say this all the time. I really think that when you do functional medicine right, you're actually doing conventional medicine right.
Uh,
Using all the tools with the lifestyle, with the root cause. And if you need medication and you need medication, you move the levers as needed. But then the other piece that you talked about, which I think is so great, I'm already thinking of like 3 of my patients that are constantly, you said parasite, and I was right there, constantly looking for the next thing. It must be this, it must be this. And it's like, you are leaving conventional medicine with a complaint of, I don't want the pill for every ill. Got it. But now you want it to be like a very A to B solution. Like if I just take the probiotic, if I just get rid of this parasite. And it's the same type of thinking.
the same type, yeah.
Same type of thinking. And so I think, what did you call it? What'd you call it?
Green allopathy. Yeah.
Say more. What does that term mean? I don't know that term.
I mean, green allopathy is exactly what you just said, where if we're just using supplements and, functional medicine testing instead of medications, we're still putting a quote unquote band-aid on things. We're just swapping, quote unquote naturals for synthetics. And there's like, I mean, I could talk about just that one thing for hours, because if you look at most of the medications on the market, they come from natural sources. We just extracted the most active therapeutic agent out of them, right? Like we have things from snake venom that lower your blood pressure. We have white willow bark, right? That we've taken out, and we have aspirin now. Like we have like all of these things. And so this whole idea of quote unquote natural, like, has to start to be pulled apart, because it has very little standing when you actually look at it under a microscope. But again, like, that's another thing. Is that we want to look at, if we're really doing root cause holistic medicine, we want to look at the whole person and identify all the pieces to the pie. And a lot of the times when people come to see me, a big part of the pie that they haven't examined yet is their thoughts, beliefs, and behaviors around their actual condition. And sometimes that's not the case. Sometimes that's in place. And then it's just like, oh, you're just super constipated. Like, we just need to fix that. And that's like a really easy, like,
You
those are
just need,
former cases.
you just need
Yeah,
some
like,
magnesium.
yeah, exactly. Like, and you see people of all kinds of
Yeah.
but is to be able to identify like what pieces of the puzzle is missing for you, and to be okay if it is about the mindset piece, if it is
Yes,
a piece that's holding you back.
that's true. Now, all that being said, I would be remiss though if I didn't say, and I imagine that you agree with this as well, that the one aspect in conventional medicine that they absolutely refuse to talk about is the microbiome in a significant way. Sorry.
Yet I would say yes and no at the same time. My name is Mary, and I feel like I am contrarian sometimes, so I have to warn.
No, I love it. I'm down for it. I asked for it without knowing what you would say, so I'm down for the.
So the microbiome is this huge area of research, and we have people like Rob Knight. I think he's still at UCSD, who's like one of the lead researchers, PhD, looking at the microbiome. We have many other people that are doing the same. That we know so much about it now, and yet we've still scratched the surface.
100%.
And so I think that most people would acknowledge that yes, the microbiome probably is influencing a lot of things in health. To what degree, I don't think we know quite yet. But my issue with the microbiome and pulling it into clinical practice at this point is I don't think that we know enough about it to make clinical decisions majority of the time on the microbiome. So I actually don't do stool testing.
Mm.
Unless of course, I'm looking for, if somebody goes to Mexico, they come back and they have diarrhea. We're doing ovoparasite, testing, or, with inflammatory bowel disease, we're looking at calprotectin levels. So I do conventional stool testing in that manner, but I'm not doing microbiome assessments with people. And then having to go into depth about why I kind of think that this isn't helpful for people if we want to go that way.
I mean, we can. I hugely disagree with you on this, and that's okay. And this is why this might be a great podcast. I agree with you on that, but I do think you're right that we haven't even scratched the surface with that. I agree with you. But if you notice, my question was, is conventional medicine ignoring it? And I think it is. Now you're giving me and telling me, well, we don't know enough about it, which I agree. But conventional medicine doesn't even have a conversation about it. Like,
And I could be wrong, but my thought is that they're not having a conversation because we don't have a tool yet that is applicable to the clinical setting to actually use it with. So, like a comprehensive stool analysis, I don't think at this point has a place in clinical practice. And I think if you're open, it would be fun to have it.
Yeah, we have this conversation. So right now, I'm in Panama in this clinic with the most robust medical team outside of America, who is absolutely doing phenomenal high tech work on microbiome, really truly testing that it's way more than, I won't mention company names, way more than what you and I are seeing in our classic microbiome testing. And without question, they are changing the levers of the microbiome and seeing remarkable results in various people on the spectrum, from verbal, nonverbal, behavioral changes. Like there's no conversation of it being a placebo effect because half the patients don't even understand what's happening around them. So I would say that there is room, there's already happening. Clinical improvements, clinical outcomes are already being shaped by moving the levers of microbiome. I would say that one of the reasons we don't have enough is because we're not willing to have this conversation in conventional medicine, so we're not putting the proper resources behind it, right? This is the conversation of how do you get that gold standard testing if the people in charge of the gold standard are not willing to have this conversation. I could see by your face that you're not so on board with it. That's okay. That's what's going to make this podcast amazing. We're going to irritate both sides. Like people who agree with you are going to be irritated by me, and the people who agree with me are going to be irritated by you, which just means we'll have more people listening to it, which is great. Um,
I'm not, it's not that I disagree with you. I believe in like 30, maybe even less. I mean, with AI and like, this things could go much faster than we think. But I think in the future, we're going to know, hey, like, this is what it looks like when somebody had X disease. And it's because this ratio is off of these microbes in the gut. And if we adjust it and lower this strain, then you get resolution of symptoms. I think for certain things, we're going to like have things like that. I think metabolites are going to be a huge thing as well. Okay, this guy produces, like this bacterial strain produces this metabolite, and we know that's actually protective. And I'm making all of this
sure, sure.
protective X, Y, and Z of the gut, and then that's what's missing in, ulcerative colitis or whatever it is. And so by no means do I think that this isn't an area to study. I think it's an area that's going to have so much fruit coming from it. I just don't think that we have the fruit there. And it sounds like maybe in Panama they're doing this stuff and it's just not published yet. And that's where we're looking for, right? Like we need published information so that we can have more concrete data about what it is. But when you go to your average, functional medicine doctor, they're doing comprehensive stool analysis. And a lot of these tests are just looking at the genus level. So they're giving you amounts of things like Escherichia. So versus the strain level, which would be Escherichia coli 015, yes, then that which is the pathogenic strain. But then you also had E. coli Nissel 1917, which is a commensal good strain, right?
Yes.
Just done at a genus level, in my mind, is like garbage. It's like,
Yeah.
why would you ever do that?
So there are testing that go beyond.
And then you have shotgun approaches. So then you can do a full sequence of the microbiome that comes out, and you can get strain level. Most of them are doing that, but then you have that. But then there's still an inherent issue with that. So if you take somebody's poop, you are automatically taking out the anaerobic bacteria that could be there because it's exposed to air. So what you're getting is a true sample of stool. You're not necessarily getting a sample of what's in the small intestines for sure, or what's in the proximal large intestines where you're still seeing anaerobes. And so we just don't have a great method to say who's actually in there and where are they located, where is the disease. But if you have Crohn's disease and you're looking potentially at small intestinal microbe destruction, right? You're not even looking at large intestine. And so I think that there's some of this that we're amiss at this point. And then when you the actual research, majority of these things, I mean, we know E. coli 015787 can cause travelers diarrhea. I mean, we just know that. And then we know the treatment for it. So that's like an area where we do know a lot about. But then we don't know, like in IBS, like what is the ideal gut microbiome and what can go awry that causes IBSD? You don't know the answer to that. And I think that there's some people that are kind of taking guesses. And I think sometimes maybe people are just getting better because you're treating something else and you're getting the benefit. Like maybe you're treating SIBO and you're telling them because Prevotella is high on their stool
I'm gonna
sample.
I'm gonna invite you to some of the people I talk to. So I'm gonna tell you that while I agree with you, there are already some of the things that you're thinking in the future, I do think are already happening and people are already moving the levers on certain aspects of health. And yes, you're pointing out to the areas that we have not yet discovered. Oh, we're not getting full, we didn't get the small intestine. Okay, at least we got some. It's better than none. I mean, medicine has always been like that. We don't know exactly what happens in dementia and Alzheimer's, yet it doesn't stop us from giving pharmaceuticals somewhere along the path of how a tangle is made. So not seeing the whole picture has never stopped, scientific inquiry. That's how we get to the whole picture. So I would say to you that I would not throw the whole idea out again, as you, and I would say to you that a lot of it is already happening. And the reason I'm taking a moment to say this, well, first, my audience expects it. Oh, but I don't wholeheartedly agree with everything you're saying. But I think it's important because I think there's a lot of validation in getting some treatment. And at the same time, I do think a lot of people who are practicing functional medicine are too much on the macro, and not everything is gut and not everything is microbiome. So I could see where the hesitancy is, but I think there's a way to differentiate between different types of functional medicine providers. And it's just like the providers who do like mold remediation. There are some people who have absolutely no idea what they're doing. But then there are people out, I'm in a mentorship group for mold, and the person who introduced me to the concept that you're talking about of like this mind connection to your ailment is actually Dr. Neil Nathan, who's like a mold guru. And he was the one who said, your patients will never get rid of their mold illness if you're not dealing with this mind thing. So I'm so on board with that. And I'm so glad that we brought that up. And then I saw that one of the things I asked you, I love this. This is like so everything like kind of upended, which is so good. And so what was the biggest challenge you face as a disruptor? And most people will say, oh, it's the conventional medicine, blah, blah. But you wrote influencers and social media. Say more. I'm loving this episode.
No. And like I said, I'm a continuous learner. So I want to know like all the things that you're reading about the microbiome. So I want you to send them to me. And then
Cool.
let's fun, like no guarantees people listening, but maybe we have like a reverse episode. You're on mine and we continue the conversation because I think
Deal.
those are be really helpful for everybody involved. So either influencers, love-hate relationship where I think social media is a really powerful tool to get your message out to many people. Like the fact that I have a platform that I can speak potentially 40,000 people, which is small for a lot of influencers, but like for
Big.
me, for myself,
So big.
like how is that even possible? It's wild. Like we're in an age that things are really expanding, like what we can actually do. But so that's my love part of it. And then the other part is that there's a lot of misinformation on social media. Like that means that anybody can also have a following of 40,000 to a million, whatever people and say whatever you want. And I remember when I was in my early 20s, again, like listening to podcasts, like I don't even know if like podcasts had just come out or something, but I was definitely listening to them. And in my mind, if you were on a podcast, it means you were credentialed, what you were saying was true, and like I can take it to heart. And now I'm on podcasts and I can literally say anything I want right now and it can get aired, right? So I think I have this level of skepticism that's developed because I went down a few paths that were very disappointing at the end of them with
Yeah.
nothing. You
Well, I would say two things of that. One, it doesn't stop with social media. Same is true of the news. It depends on which news you're watching. You're going to get a completely different variation of reality. So it's not just a social media issue. It's really up to the consumer to get fully educated in every outlet of information that you're getting. It's not just social media. But
1,000%.
but the other side of social media is that it's remarkably democratizing. And when I used to practice, I don't practice anymore now, I just speak. When I used to practice, people would find me from like, trailer parks in the middle of the country that had absolutely no access to this type of thinking and had no access to this type of help in their immediate community. I've had people all over the world actually reach out to me and so the ability to access help people who were absolutely desperate and needed options, I wouldn't trade that for the fact that there are some people who don't know what they're doing. But, you know, McDonald's exists and everyone eats that too. And you could really just look that up too. So like, so And at the same point, the health food stores exist right next door to the McDonald's. So at some point, there is consumer choice and consumer education. But I think for me personally, I think the reward of getting people access to information and not, there was that time that you're talking about where everyone's credentialed. Everyone was also a particular gender and a particular skin color with particular credentials that only they had access to. And that were the authority on everything, and discarded race difference, discarded what women needed and what conversations with menopause and hormones. So like there is a really dark side to going back to that area of, oh, they were credentialed and they knew what we're talking about. But did they? They knew what talking about for them. But did they know what was talking about for everyone else? I could tell you right now, as a woman, most of my patients still have trouble getting hormones because the credentialed world has not recognized it yet. So I'm down for the risk of some people out there not knowing what they're doing if it means more people get access.
I
So
I mean, it's so wonderful when you hear, people in rural areas that wouldn't have access to any information about like integrative medicine that now have access to it. So it's a double-edged
the
sword.
Dover story, yeah.
And I agree with you. I wouldn't trade it. But I think I forget what the actual question was, but it's definitely one of my frustrations when people come and they're like, should I be taking, this crazy supplement that this influencer is selling? And I'm like, they're making money.
Right. Right.
Not going to
I agree.
see that came out of like this supplement company
I agree.
for this today.
I agree. I'm always skeptical. I tell patients, I'm skeptical of anyone who gives you the same protocol for you, your brother, your sister. Yeah, the same protocol is already a problem. And it is a problem if they think it's one thing that's going to solve it. Like one pill, doesn't matter what it is.
No matter
I love it.
what.
So then I said, let's see. Okay, how do you handle pushback or criticism for those who resist change in the medical community? You said you ignore them, but who are you referring to when you say resist change in the medical community? Like, who are the people that you think are resisting change?
I think that was your question.
Yes, my question. So I said, how do you handle pushback or criticism for those who resist change in the medical community? And you said, I ignore them. So I guess I'm asking who is them.
I guess there might be just confusion about the question, but if people don't want to exercise or like they don't think that, nutrition is important or whatever it is, it's like, I'm not the person that needs to convince you of something. People are usually coming to me because they're interested in my views of things. So I try to stay in my lane and just, do what I can for the people that are open and
Sure.
on it. And yeah, keep my eyes on my own paper.
So what is your go-to solution to help people separate that mind-body loop that you described? What's your go-to method of helping people disconnect that loop?
Yeah, the first part is just to identify where they're stuck. So one of the questions I'll ask people, say they have IBS, is what percentage of your day do you think about your GI symptoms? And at first they don't know the answer to that. I'm like, really think about it. Like from the time you get up, you make breakfast, get lunch, work, like what percentage of that day does your mind wander off to like, am I bloated? Is this going to affect my stomach if I drink this milk or if I have this broccoli? Is it going to cause bloating? Like what percentage do you think you're actually devoting to this GI issue? And so just to start to evaluate the answer to that question from people is astounding. Like it's not uncommon for people to say 50% of
Wow.
percent of my day. And I'm like, wow, do you know like what that actually means about how much energy you're putting towards this? And then we'll go one step deeper is like, what are the thoughts that are coming in? Is it, oh, I don't have any clothes to wear? Is it, do I have cancer? Is the bloating a sign of cancer? Is it, oh, there's nothing I can eat at this party, so I don't want to go out with my friends anymore? So we really start to like pull apart and just get familiar with what's going on in the mind. Once we're familiar, we know what actually is happening, then it becomes very clear about what we need to do. It doesn't mean it's easy, but we're starting to break those patterns to say, okay, you're not looking at your stool anymore. Like it's
Yes, we're
unnecessary.
done. We're done.
You're done. You're going to go to the bathroom. You're going to flush the toilet. You're going to leave the bathroom. And so we just start to kind of take off,
Break patterns.
break patterns, create new patterns. So if they're thinking, is this going to cause me bloating if I eat it? We're saying, hey, what's a good coping thought instead of that one? What can we replace that with?
What would be a good coping thought? Give us a pearl.
So if somebody says, sometimes broccoli causes bloating, sometimes broccoli doesn't cause bloating, I don't really know. And they don't have an anaphylactic allergy to broccoli, right? So then we're going to say, well, instead of, is this going to cause bloating? I want you to first identify, ooh, that thought just came in my head. I'm going to break that now. And you know what? Sometimes broccoli causes bloating, sometimes it doesn't. So it's more likely the act of eating that may cause bloating versus the broccoli itself. This thing is full of sulforaphane and fiber, and it's good for me. And worst case scenario, if it does cause bloating, it's not going to kill me. It's actually going to do zero physical harm to me. And this is obviously all under the assumption that we know we're treating irritable bowel syndrome.
Right, right, right. Oh, amazing. I love that. So it's really like breaking pattern and taking a moment to think. And what we do with any type of like automated reactions or behaviors that we're trying to work on, right?
Uh-huh. Yeah.
Anger or snapping at someone or like the same thing, like, hold on. And why are we angry? Right. Like, so I love that. I love that so much. Okay. What?
People listen and they're like, well, that's too easy. Like, that's not going to work for me. It doesn't work if you don't try it. And it's incredible. Like, I
No,
think
it's incredible. It's just, you have to practice
yeah,
it.
practice over and over again, especially if it's a big part of your day. There's areas that you don't even know you're thinking about your stomach and your.
Yeah. It is a practice. It is something that you have to do all the time until you don't have to do it all the time because you're doing the other thing all the time. Yeah. That's 100% true. Okay. What do you want to tell our shared audience that have not asked you?
I don't know. I mean, this is a great. I love that we had a few little, discussions, and I'm trying to think of anything else. Oh, I mean, just like overarching messages, like health can be much more simple than we make it out to be, I think sometimes. So I think sometimes we're making it so complex and we need to go back to the macro. And then there's obviously times to dive into the detail. But I also think like social media, one of my frustrations is it can make health so complex. Like I have to wake up and do a cold plunge and then do a sauna and then eat get supplements and then I have to go and, and do some red light therapy. It's like, whoa, like you can be so healthy with such a simple, straightforward routine.
Man.
Yeah.
No, I like that. I like that. Like, just bring it back to basics. I like that because it gets the stress you're going to feel because you don't have the cold plunge and the red light therapy and the hour of meditation before you start your day. And that's going to be stress for you too. That is very sound advice. Like, take it easy. Take it easy. It's good. It's going to be all right. Yeah. That's great advice. Amazing. So I have you, I'm going to put your LinkedIn on and your Instagram on. And what kind of patient would you like to reach out to you?
So right now I have a concierge practice based out of Los Angeles, and it's for people that one of two categories, and I'm really clear about like who I'm really great at treating. It's people that are pretty healthy and want to just either get a little healthier and stay healthy. They've got weight to lose or high cholesterol, high blood pressure, really lifestyle preventative medicine. Longevity medicine. It's you want to use the buzzword. And then I also help people with chronic GI issues. So irritable bowel syndrome, bloating, constipation, and diarrhea. And I work, like I said, on a monthly concierge model and we do a deep dive in your health, but we also stay macro and make sure things are simple and attainable and you just know exactly what you're supposed to be, eating for your health and exercising and the big things.
I love it. So if you were one of those two categories, you make sure to find Dr. Mary and she's going to help you. I love this so much. Thank you so much for being here today.
It was really fun. I'm glad it all worked out.
Please, yes. Thank you.